Hey, it's Dr. Daniel Jacobazzi from PhyxMe Physical Therapy, and I wanted to post a little bit of a segment today about the importance of healthcare providers allowing patients to have hope. And beyond having hope, having the ability to take control of their situation. And what I mean by that is, in the medical system, really patients are told what to do, they're directed what to do, and they're not given a whole lot of power over their situation. And so that's one of the reasons why I really like the neuropathy program that we use, because much of the work is done at home. There is quite a bit of patient work that needs to be done. And some might look at that as a negative, like, oh, I have to do so much work. But it's the work that creates the success. And of course, the more a patient, the more you are involved in your health, the better the result you're going to get. And so when we're talking about health, everybody assumes, or we've been trained rather, that health is a point. Yeah, I'm healthy. And of course, health isn't a point. Health is a direction. So you're either going up or you're going down with regards to your health. Very difficult to just keep it flat. So even if it's just a slight uptick. But anyway, the bottom line is that health is a direction. And so our job here, my job specifically, is to help patients get pointed in the right direction. So whether that's talking about the best ways to eat, supplements to take, equipment to use, therapies that we can provide in the office, it's very much a team approach, and giving patients back their power over their health, so they don't feel helpless, so that they don't sit there and think, oh my gosh, I'm never gonna get better, I'm never gonna get out of this pain. Again, with the neuropathies, we've had people who've been experiencing pain for as long as 15 to 20 years being told there is no cure. We even had an MD refuse to write a referral for the neuropathy treatment from a patient who'd been with the MD for the 20 years, because he's been complaining about, first it was restless legs, and of course now it's neuropathy. As you'll know from previous videos, restless legs is the beginning of neuropathy. This MD refused to write him a referral and said, well, let's do more testing. Great, okay, so you're gonna test more, you're gonna name it something else, not neuropathy, even though we know it's neuropathy. What is that gonna do? It's gonna keep that patient stuck in that loop. More drugs, potentially interventions maybe, none of which are necessary. This can all be solved with the program. And I'm not saying that we can solve every situation. That's certainly not going to happen. But the way this program works, it can solve a lot of problems. And again, as I mentioned all the time on the videos and to my patients here in the office, that the success rate is 97%, which is outstanding. And again, in here in our office, we're batting 1,000. I know that can't stay forever. But to this point, everybody who's out of the program has gotten significant improvements and been very happy with the results of their program. And that just goes to show, just taking charge of their health and moving in a new direction gives a good result. So if you're ready to take back your power, ready to take charge of your health, if you don't want to delegate to somebody who doesn't believe that there's a cure anymore, like that MD who refused to aid his patient in the direction that he wanted to go, then we're the place for you. We're here to help. And worst case scenario, if we can't help you, we will find somebody that can. That's what we're about. Thanks and have a great day.